Hi, my name is Haley Zanga, and I will be talking about the promising outlook of mesenchymal stem cell therapy as a novel treatment for traumatic brain injuries. During this presentation, I will be talking about traumatic brain injuries, a brief overview of what they are, the pathophysiology that is behind them, and current treatment options that are available. I will then discuss a new emerging treatment for traumatic brain injury, which is stem cell therapy. I will then provide background information as well as the different sources you can use. I will then focus my presentation on one specific type of stem cell called mesenchymal stem cells and look at its ability to possibly become a therapeutic treatment option for traumatic brain injuries. I will then look at preclinical studies done using these stem cells for traumatic brain injury models. Then the conclusion and data gaps in future research. Traumatic brain injury is a major cause of death and disability worldwide. They are becoming more and more prevalent, affecting an estimated 1.5 million Americans annually and contributing to 50% of all trauma-related deaths. Traumatic brain injury is characterized as an alteration in brain function or other evidence of brain injury that results from an external mechanical force, possibly leading to permanent or temporary impairments. These impairments include deficits in social, cognitive, motor, and behavioral functioning. Traumatic brain injury can be caused by many things, such as direct impact, extreme acceleration or deacceleration, rotating forces, or outside forces that impact the head that causes the brain to rattle back and forth. Traumatic brain injury induces a complex pathophysiological cascade of cellular events that consists of blood-brain barrier breakdown, widespread neuroinflammation, diffuse axonal injury, and subsequent neurodegeneration. Traumatic brain injuries can be classified into two groups: primary injury and secondary injury. Primary injury occurs at the moments of initial trauma and include contusions, damage to blood vessels, axonal shearing in which the axons of the neurons are either stretched or torn, blood-brain barrier and meninges may be damaged, and neurons may die. The primary injury then leads to the secondary injury. The secondary injury is an indirect result of the injury. It occurs in the hours and days following the primary injury and plays a large role in the brain damage and death that results from the traumatic brain injury. Following the initial injury caused by the trauma, an intense localization of inflammation occurs, worsening the damage already done and expanding the site of injury to include neighboring neurons. The primary injury causes a complex cascade of events that are key characteristics of the secondary injury, which include things like ischemia, cerebral hypoxia, and impaired metabolism. To date, there are no pharmacological agents or effective treatments to improve neurostructural repair and functional recovery after a traumatic brain injury. Current acute treatment of traumatic brain injury has been limited to prevent further swelling and pressure in the brain and optimizing cerebral perfusion to prevent further inflammation and cellular damage, whereas chronic treatment focuses more on cognitive, motor, and behavioral rehabilitation. The primary focus on treating traumatic brain injury patients is aimed at reducing the extent of the injury rather than repairing the damage. As of right now, little treatment options are available for patients with traumatic brain injuries. Thus, there is a need to develop further treatments. With the lack of current treatment options for traumatic brain injuries, researchers have started to consider using stem cells as a therapeutic treatment. Given their capacity to regenerate cells lost through disease or injury, stem cells offer a promising possibility to use as a treatment for traumatic brain injuries. Due to the limited capacity of the brain to repair and replace the missing tissue after injury, stem cell transplantation has now become a prospective treatment for traumatic brain injury patients, since transplanted cells have shown the potential to differentiate into region-specific cells and integrate into the host tissue to replace the lost and damaged tissue. Transplanted cells also could provide a type of nourishment support to the host tissue and help facilitate regeneration. Stem cell therapy has now become a hot topic for treating traumatic brain injuries since recent research has shown that stem cell therapy has had positive therapeutic effects in patients with neurodegenerative diseases such as Parkinson's, and was shown to be clinically safe when administered in patients with injuries such as myocardial infarction, stroke, and acute kidney injury. Using stem cells for traumatic brain injury treatment could potentially mean overcoming the damage done to the neurons in the brain. The goal is that the stem cells would work to repair, or partially heal, the connections between the nerves and the cells within the brain. In the end, the goal is that this will help restore motor, cognitive, and behavioral functions that are often lost because of a traumatic brain injury. Over the past 2 decades, researchers have explored a wide array of cell sources for neural transplantations. The most popular ones include neural stem cells, embryonic stem cells, and mesenchymal stem cells. All three have been shown to be able to differentiate into a neural lineage, which is an important factor to consider when choosing a source. However, serious challenges occur with almost all of these. As an example, a serious challenge with neural stem cell transplantation is the ability to deliver the cells to the area of specific interest. They are also more difficult to isolate and culture. Embryonic stem cells are great since these cells can proliferate without limit and become almost any cell type. However, there are many ethical problems that surround them. Due to the obstacles of using adult neural stem cells and the ethical problems that surround embryonic stem cells, mesenchymal stem cells have now become a popular choice to use for stem cell therapy. Mesenchymal stem cells have become of interest to scientists since these cells are found in many and can give rise to many tissue-specific cell types. Researchers have also found many properties and abilities mesenchymal stem cells possess that may be helpful in treating traumatic brain injury patients. I will go through and talk about each one of these. Like I stated earlier, it has been shown that mesenchymal stem cells can differentiate into neural cells. The ability of mesenchymal stem cells to differentiate into neural cells was first recognized by Sanchez-Romaz and his colleagues. They showed that both mice and human mesenchymal stem cells had the ability to differentiate into neurons and glia-like cells under certain culture conditions. Furthermore, when stained with antibodies before implantation, this staining disappeared throughout the experiment, showing mesenchymal stem cells had differentiated into another lineage where mesenchymal stem cells acquired the phenotype of their host. It was also found that these stem cells are capable of secreting cytokines, chemokines, and growth factors. These factors secreted by mesenchymal stem cells have an important role in creating favorable microenvironments for the proliferation of neural cells at the injury site. These soluble factors are capable of enhancing the survival of stem and neuronal cells. These neurotrophic factors secreted by the mesenchymal stem cells have been found to promote angiogenesis and neurogenesis in the injured brain, enhancing the multiplication of neuronal cells at the damaged site. Mesenchymal stem cells have also shown the ability to migrate to the sites of traumatic brain injury. Many mechanisms have been postulated, yet no one knows exactly how this works. Mesenchymal stem cells have also been found to facilitate the injured tissue's own regenerative process. Mesenchymal stem cells implanted into a mouse hippocampus were found to heighten the proliferation, migration, and differentiation of mated neuron cells. This mechanism is thought to be related to chemokines released by mesenchymal stem cells or indirectly via activation of the astrocytes. This was shown when looking at lung tissue treated with mesenchymal stem cells. Researchers found a decreased expression of inflammation-associated cytokines, which facilitated the repair of the injured tissue. Over the last decade, researchers have been looking into strategies to enable access through the blood-brain barrier. Recent research has shown that mesenchymal stem cells have the ability to cross the blood-brain barrier. The ability to cross the blood-brain barrier is important for the neurotherapeutic drugs. The mesenchymal stem cells' ability to cross the blood-brain barrier is a unique and promising feature supporting the usefulness of mesenchymal stem cells as a traumatic brain injury treatment. With the known advantages of mesenchymal stem cells, more and more researchers have started looking into using mesenchymal stem cells in traumatic brain injury-induced animal models. A variety of studies have shown that stem cell therapy in mice and rats with traumatic brain injury has had significant improvements in cognitive and motor functions. One study in particular, shown here, measured the effect of bone marrow stromal cells administered intravenously in rats with a traumatic brain injury. Rats were injected with mesenchymal stem cells labeled with BRDU into the tail vein 24 hours after traumatic brain injury and examined throughout a 2-week period to evaluate neurological function using NSS scores and the ROTAR test. You can see below there was a significant reduction in neurological deficits at day 7 and 14 compared to the controls, figure 3. Where in figure 4, it showed similar results where there was a significant improvement in motor function at day 14 after treatment compared to the control. These results suggest that IV administration of mesenchymal stem cells may be useful in treating patients with a traumatic brain injury. This is just one study showing that the use of mesenchymal stem cells in traumatic brain injury can improve motor and cognitive functions. Another study, shown here, also looked at the transplantation of mesenchymal stem cells into a rat model with induced traumatic brain injuries. Their study showed that some of the BRDU labeled mesenchymal stem cells migrated into the parietal lobes of the injured brain, whereas the immunofluorescence microscopy of the coronal sections showed no localization of BRDU positive cells in the traumatic brain injury group, figure 5. This migration to the injured brain tissue was seen at 14 days after. In addition, double staining showed that some of the implanted mesenchymal stem cells expressed a neuronal marker and an astrocyte marker in the transplantation group, figure 6 and 7. They also showed promoted functional recovery that was seen at the end of the second week. These findings are similar to the study I had discussed above. The advantages and properties that mesenchymal stem cells possess may have the capability of helping neuronal tissue damage that resulted from traumatic brain injury through stem cell therapy. Mesenchymal stem cells have shown us their prospective role in healing the damaged tissue by aiding in decreasing the inflammation in the host tissue, encouraging the regeneration of damaged nerves, and their tendency of homing near the injury site. Mesenchymal stem cells' ability to migrate across the blood-brain barrier would also overcome a major problem faced in treating traumatic brain injury, which is selective and targeted delivery to the injured brain tissue. Not only that, but numerous preclinical studies have shown reduced neurological and motor deficits in traumatic brain injury animals. Stem cell therapy, using mesenchymal stem cells specifically, has shown a promising outlook in the management of a traumatic brain injury, a condition that has once been resistant to previous interventions. Even though a significant amount of research has been looked at about the complexity of the traumatic brain injury and the utilization of stem cell therapy as a treatment for traumatic brain injury, a lot still remains unclear and further research is needed to better understand and to determine the best method to promote recovery of the damaged brain tissue. Right now, we have a limited understanding of potential complications, routes of administration, and use of combination therapy are 3 other topics that need to be explored further. Also, our well-characterized preclinical studies with animal models for traumatic brain injuries should help guide further clinical trials. However, many studies on the applications of mesenchymal stem cells in traumatic brain injuries done in rat and mice have been done over the course of days and months. Longer-term studies are needed to explore the safety and efficiency of these cells during long-term therapy. Thank you for watching.